I want to ask our listeners a question. I want them to think about what is missing from what I'm going to read. I'm going to give you, the listeners, typical accommodations from an actual 504 plan. And Jen, you kind of gave them the answer. So if they can think back on maybe what you said, I think it's going to hit them. But here we go. Allow a child to communicate via pointing and gesturing. No pressure for speaking. Provide a tablet for writing. Provide assistive devices such as a tape recorder. Give them a whiteboard to communicate as well. Sit with a familiar person. And don't ask open-ended questions. So I want our listeners to think about what's missing there, because this is so important. And I'm going to give you the answer. Jen, you know what I'm saying, right?
I do.
So what's missing are the interventions. When we talk about accommodation plans, and we're going to go a little bit more into specific as far as how to get these plans going, but also which plan might be best, and then giving you, obviously, recommendation for accommodations and so forth, and interventions based on the whys and the stages. But you have to think about accommodation/interventions. And too often we see plans that are very much keeping them where they're at. And although we're all about building comfort as a precursor to communication and understanding the whys and understanding their baseline stage, our goal is for progression of communication into a confident social communicator who is verbal. And not just verbal, but initiative, elaborative, expressive if they have that capability. So by no means do we want to keep them accommodated in terms of no progress. So yes, this child has no incentive to communicate. There's no reason to become more, to go across the bridge, because there's nothing in place to help that happen with this. This is keeping them status quo, giving them the accommodations to function, but it's not the progression. And those interventions are what are the strategies needed to be able to make the progression. And that statement, don't wait, facilitate, is critical, because we saw this in our studies. We've seen this across the board throughout our years of working with families and schools, that unless staff facilitates interventions, strategies, children don't tend to make progress. So if you're taking your child for therapy and hoping by going to therapy every week, if that's what you're doing, that they're going to miraculously make a ton of progress in school, I'm going to let you know it's probably not going to happen. Will they make some? Yeah. But will they make enough? Probably not without the interventions. I asked myself two questions. How is learning affected? Is the child on grade level? Does the child begin to start their work, complete tasks on time? Is the child distractible, having trouble focusing, needing redirection? Is their academic progress lacking? They're not improving at an appropriate rate in terms of their social communication and academics. So to me, the more learning is affected, Jen, the more I think an IEP is warranted. The more severe the child is in terms of their selective mutism, their social communication anxiety, the more shut down, the more globally mute, the older they are, the more services will probably be needed. And that's where I may direct them to an IEP. But I don't want our listeners to get worried or scared or, oh my gosh, I have this, I have that. It again goes back to, what can this school do under whatever heading it is to be able to make this happen? And that's where we, Jen, come in, because it's us as the clinicians that do these selective mutism evals, do the intensives, really get to know these kids and what they're capable of to help direct them. So I always tell families, rely on us to guide you. And that helps relieve their anxiety. So what are your thoughts on what I just said in terms of choosing which plan? Because I think our listeners are getting an idea that the 504 is a little more generalized, an IEP is a little more formalized.
Sure. Yeah. A couple things you noted when you went back to giving those examples of, sitting with a buddy, prompting for them to write, having, like some younger kids have a tablet or a boogie board, a whiteboard, having all of those components.
Wait, what's a boogie board?
A boogie board it's like a whiteboard, Right. But you can write on it and erase it. It's electronic. So
Yeah.
it's you don't use an eraser.
Yeah.
So but a lot of our kids have those and they're fun and they're great.
Yeah.
You mentioned something. I just always want to point this out. Helping our kids have a comfortable way to communicate at baseline. And this really goes back to that social communication bridge. So for our listeners who go, may be on our website, looking at our resources, the social communication bridge is such a key part of educating school and educating your child and educating yourself, even educating your current provider. It's really an important piece of looking at the accommodation plan, because if we applied all of the examples that you gave, they all help our child to have stage 1A communication or stage 1B communication, which is nonverbal responding or nonverbal initiating ability, which is good. All of those things that you mentioned are inherently good. They're good for our kids. However, and there's always a however, because if we have those as part of our accommodation under, let's say, our 504 plan or even our IEP, that's great to get them started and to cover their bases in terms of, I know I have a buddy I'm sitting next to. I know my teacher isn't going to cold call me in the middle of class, but they might, address me one-on-one or have me write my answer down or chat it in the chat box if I'm doing a virtual component or using our tablet. But the difficulty with this is the longer we go, and again, this is where our kids' presentation is so important, the longer we go with only accommodating nonverbal behavior is a few things. One, depending on your child's personality and their presentation, this can sort of sabotage progress. The longer they stay nonverbal in school, if you have a child who their presentation is just, no one's heard me speak, and now it's been 3 months of school, and no one's heard me, to try to bridge up at this point feels way too hard, and way too much attention is on me. The expectation is greater, and therefore I might be too anxious and overwhelmed to even try, and I might be more resistant to try at that point if other strategies haven't been implemented to build upon. Another child may say, I've gone 3 months in school. Why do I need to speak? You mentioned that. The motivation to do it, I have no incentive. I can do everything in school, just not verbally. I can get my friends' attention, my teacher's attention. I can do my work. I do my reports. What is the incentive or motivation to actually speak in school? And so it becomes harder the longer our kids go, where they're stuck in nonverbal, or the expectation is just to keep them nonverbal. Every great accommodation, every positive strategy, if overused too long without looking for signs of readiness and trying next steps, can really enable our child to get stuck in the stage they're in. And that's for all stages on the bridge. So I always like to point that out. That is a great starting place, but that's not where we want to end, right? The end all and be all is not we keep our child mute in school, comfortable and mute. It's let's allow them to be comfortable, give them a means to communicate, and then let's look for the strategies that are correct for your child, depending on what their diagnoses are and what makes up their why and contributing factors of SM, so we can make progress throughout the school year. And the other piece that you mentioned was like the 504 and the IEP. Sometimes too, under the IEP, we have to have an evaluation done to qualify, and our districts do that. Now, I know some of our listeners are thinking, oh, so an evaluation to see what my child qualifies for. Does my child have any learning difficulties, any speech challenges, or whatever the case may be? And I know the common question that I guess get asked all the time, and I'm sure you do too, is how do you test a child with selective mutism? Because that's another piece, right, of having to provide an IEP, is we have to have an evaluation process to determine their eligibility. And so, yes, the more challenges with learning, the more severe the mutism, the older they are, where they're not as functional, usually leans us more towards use of an IEP. We're going to need more accommodation and means to implement strategies versus the 504. Many districts and schools have a very difficult time testing a child who does not speak. So then what do we do about that? So a lot of the work that we do with schools are helping to give strategies of how to provide testing, because what we often see then is we're not really getting a true sense of what this child's capability is in the test. If let's say they're so anxious that they barely non-verbally give answers to a test, that test could look and give sort of a false indication of their learning challenge. For some kids, they're not able to verbally communicate answers. We have many speech and language evaluations that come back and they say their speech and language seems intact. because they were able to do the receptive end by pointing or nodding, but they couldn't do the expressive or the narrative language because they couldn't speak to anyone. So therefore, a judgment is based on some of the work they did, but not really looking at truly their narrative language skill. So oftentimes we have these tests come back that don't really show us an accurate view of this child's ability, where we have a lot of families that might seek out what we call an IEE, which is an individualized education evaluation, which means maybe they've gotten the results back from your school that say you do not qualify for an IEP. So we might do privately another individual education evaluation or independent educational evaluation outside of the district to provide another viewpoint so that we can provide strategies doing those evaluations so we have a better understanding of truly what this child's ability is. So that's another component just to think about when we're doing an IEP eval, because I know many of our families have mentioned that they've attempted an IEP and they weren't provided an IEP. And sometimes we need to do that IEE outside of the district. And sometimes the district will cover the cost of that. And sometimes, depending if they're in a private school, it's out of the parents' responsibility to cover the cost of that. But we can do an independent eval so that we can apply strategies in a different setting so we get a better sense of what this child is really coming to the table with.
Yeah, no, this makes sense. And I think it's important that families have to realize that whoever they are working with should really be guiding them to the nitty-gritties of this. Assessments is a huge area that we focus on at the Smart Center because of what we see. Either they misdiagnosed them or they didn't diagnose them. And one of the beauties of the selective mutism evaluation, or even the interview that we do with families, is to be able to determine what those underlying whys of SM are and understand their baseline, because that's the beginning part of planning accommodations, interventions, and even being able to give the school a heads up. So what we do is we'll write a letter. We'll often write the letter for the family, then they sign their name. So the schools don't know that, quote unquote, we wrote it, because we guide them. Parents are like, I don't know what to write to request. So we'll write like what we've seen, and we'll have them supply their selective mutism evaluation to the district, so that if we see underlying speech and language, or we see that there's some learning issues going on, and we see a lot of this through the selective mutism school evaluation, when we see from the teacher's perspective what's happening within the school. The child's not engaging, they're having difficulty starting, completing tasks, they're maybe below grade level, and the family's like, I don't get this, my child's so bright. Why is she not functioning in school? What's going on? Or we see some of these issues at home. So it's really important that families listening, even teachers listening, professionals listening, that full understanding of that child or teen is really needed to be able to really plan appropriate school-based accommodations and interventions. And getting a diagnosis ahead of time, in my opinion, is really important, because then you take that diagnosis and ideally you take the evaluation that you've had done to the school to say, hey, I'm requesting this, a formal letter is, and then you have a meeting with the school explaining why your clinician is recommending an IEP or a 504. If they're in the public school setting, or you're meeting with the private school to go over what we recommend as ideal accommodations and interventions, and even plan out the goals for these kids. If they don't have a diagnosis, go get a diagnosis, because that's your first part of this. Even before the testing, you need to be able to have all of your kind of ducks in a row, to go into the school where you have it all laid out. Here's my diagnosis. Here's the evaluation. This is what my clinician has seen. And then at least you're off and running with what you need to kind of show the school why you need accommodations, interventions.